Welcome to Shape of the City. I'm Clover Frederick and I'll be your host. Since 2008, Dr. Karla Lester and the nonprofit Teach a Kid to Fish have been finding new ways to prevent and reduce childhood obesity in our community. Their mission and outreach has continued to grow. Dr. Lester's here to talk about that growth, an important collaboration, and a new initiative that'll bring hope to children across Nebraska. Welcome back to Shape of the City.
Thanks, Clover. Thanks for having me.
Absolutely. Now, for those in our community who don't know about your work, tell us a little bit more about Teach a Kid to Fish and its mission.
Well, Teach a Kid to Fish was started in 2008, and that's when I left my pediatric practice. And I left to start Teach a Kid to Fish because I was really noticing within my patients, even younger ones, being diagnosed with not only obesity, but those diseases associated with obesity, type 2 diabetes, fatty liver disease, high cholesterol, etc. And so looking at what needed to happen in the community beyond just the clinic doors, started Teach a Kid to Fish. And so over the last 8 years, our vision has been creating community solutions for children's health, and our mission has been to prevent and reduce childhood obesity by empowering Lincoln children and families to eat healthy and be active.
Great. Now let's talk a little bit about Children's Hospital. So there's a new collaboration. What are the benefits to both organizations?
Well, we started working with Children's when we launched the Heroes Clinic in Lincoln. And so looking at our community and knowing that we had a gap in treatment for obese children, we worked with Children's to expand their Heroes Childhood Obesity Clinic to Lincoln. And we launched that in January of 2015. And so seeing the successful partnership that we had and that gap that was filling and those needs that were being met by Children's expansion of Heroes, we thought we'll further partner with Children's. And so that's been an exciting endeavor to launch the Children's Center for the Child and Community. Okay,
now let's talk a little bit more about the Heroes Clinic and its role in our community here in Lincoln.
Well, like I said, we had a gap in the treatment of obese children, and to launch a childhood obesity clinic is quite a big endeavor. Those aren't typically clinics that make organizations money. You have to have an organization who really has a vision and a desire to really meet that need for children and for the community. And so the Heroes program is a multidisciplinary team. So we have a nurse, a pediatrician, and I'm the pediatrician for that clinic here in Lincoln. We have a social worker, psychologist, dietitian, and a fitness specialist. So we have a whole team, and all the patients are physician referrals. So if the kids are overweight with a comorbidity or they're obese, they can be referred to our clinic. And then we also partner with the Y and the university in our community to do some group programming around nutrition education, behavior modification, and fitness.
Very good. Now, more recently, the Center for the Child and Community was established. Explain a little bit about that.
Well, Children's knows that healthcare is more, or health is more than healthcare. So about 10 to 20% of our overall health can be attributed to the healthcare that we receive. But there are issues such as social determinants of health. So our race, our ethnicity, income, poverty levels, where we live, access to healthy foods, safe physical activity opportunities. Those really are even more a part of our overall health than healthcare. So there's this strategy called population health, where we're integrating the clinical care with public health efforts, and that's what Children's Center for the Child and Community aims to do.
And how is that going to translate here in Lincoln? What are some of the initiatives?
Well, we launched on March 21st, and we're excited that it's sited in Lincoln, so it's at UNL's Innovation Campus. Teach a Kid to Fish has become a part of the center, so that's really awesome. Our programs, our staff, our partnerships are all a part of the center. Our launch communities are Omaha and Lincoln, and we hope to grow it to be a statewide initiative over the next few years. Backing up, our overall vision is that every child has the opportunity to reach their full potential, and our mission is to empower communities to support and value the safety, health, and well-being of every child. And so in Lincoln, we're launching with some partners on developing an early childhood systems network, working with Prosper Lincoln folks, and some exciting initiatives there, with working from the foundation of Teach a Kid to Fish's early childhood work with Community Action Partnership and things like that. So that's exciting. We're continuing to move to a model that creates a continuum of care for childhood obesity. Instead of just having this end-stage clinic or different, 8-week programs that we've developed in the community. We want it to be a more integrated approach with the whole community, so schools and healthcare and home and community-based organizations. Those are the kind of the top things we're working on in Lincoln.
Okay, very good. Now, throughout the years, what have been some of your biggest challenges and what sort of solutions have been out there?
Well, I think Teach a Kid to Fish is the only model that I know of that started from scratch. And most of those kinds of organizations are an extension of a healthcare organization. So I'm very proud that we moved it to that over these years, and that now this great work that launched in Lincoln has become a part of something bigger and more impactful for children with a broader approach to overall child health. So the challenges, I think, the main challenge for us has always been the epidemic itself. So just addressing this overwhelming epidemic, being a small organization, starting from scratch. Some of the ways that we've been able to do that, and I think our number one key thing is partnerships. So we've had some really key partnerships with the health department here in Lincoln, Lancaster County. The Community Health Endowment has been our biggest funder, the schools, the university.
Sure.
So that's the key has been our partnerships.
Right. Good. Now, why is an initiative like Center for Child and Community so important, not only for children, but also for families and communities?
When you're looking at what are the core issues that children are facing today, we know that it goes beyond obesity. That's kind of a scratch the surface. Sometimes I think of obesity as a symptom. And so what we run into a lot at Heroes, and what physicians are running into, what schools, educators are running into, early child care providers are those social determinants of health. So the American Academy of Pediatrics recently launched a policy statement on child health and poverty, and a technical report on how community pediatricians should be addressing it. Sometimes those come with bullet point recommendations. And so what our center aims to do is to take those best practice recommendations and align our communities with those, but really to do something to address those core foundational issues that are affecting children.
Good. Now, how can viewers get more information or contact somebody if they would like to get involved in the initiative?
Well, we're just launching, so we're working out our social media presence. The Teach a Kid to Fish site is certainly still up, so teachakidtofish.org, children's website is certainly a place to go. And I would also share my email with them, klester@children'somaha.org. You can reach me there.
Very good. Thanks so much for joining us, Dr. Lester, and for everything you're doing.
Thank you.
When we return, we're going to learn more about another disease that takes hundreds of Nebraskans every year.
Stop. One step back.
Used to be before you cross the street.
Left, right, left.
Used to be before you cross the street.
Left, right, left. 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 Left, right, left.
I'm a pedestrian.
I'm a driver.
I'm a cyclist.
And I
share
should
the road.
Welcome back to Shape of the City. October is Breast Cancer Awareness Month. While mortality rates appear to have declined in the last decade, the incidence has not. Joining me to talk about what we should all know about breast cancer are Tamara Robinson from the American Cancer Society and Dr. Derrick Anderson from People's Health Center. Thank you both for joining me.
You're welcome.
Well, now let's start with Tamara. Let's get some statistics. What are we currently looking at for cases and deaths from breast cancer in the United States?
So for breast cancer in the United States in 2015, they said we have an estimated 231,840 new cases of invasive breast cancer will be diagnosed in U.S. women, as well as an estimated 60,290 in situ cases. So that's when it's kind of pre-breast cancer. And then also that year we're expecting about 40,000 women are expected to die, which only lung cancer accounts for more deaths than breast cancer in the U.S.
Okay. Now, what are some of the biggest risk factors for breast cancer?
For breast cancer, the biggest things are age. So as you get older, your risk increases. If you have a personal family history of breast cancer, puts you more at risk. Genetic traits, so a lot of people have heard about BRCA1 and 2, the whole Angelina Jolie effect. People have heard about those. Some forms of benign breast disease out there can cause that. If you have either earlier menstruation or late menopause, kind of on both ends of that. And then if you've never had children or having your first child after the age of 30, those things can also be risk factors.
Okay, very interesting. Now, who's most at risk for breast cancer? Dr. Anderson, tell us more about the disparity for breast cancer mortality rates for African American women as well.
Well, the people that are at most risk are the ones that have a family history, and so if you have a mom or an aunt or a sister that has had breast cancer, your risk goes up. Obviously, if you're not getting the screenings that we would like you to do, your risk goes up because you're missing those lumps, those bumps that may be abnormal and need to be checked.
Okay. And now for African American women, how does that differ?
I think the most important part of that is that they're not getting those screenings done, so they're not going to the physicians with the lumps and the concerns and doing the simple mammograms or ultrasounds even that can check out some of those concerns. So if they don't go, they're not being screened and we're not finding those cancers.
Okay, very good. Now, what are the different types of breast cancer?
Well, as far as types, that is determined by the pathology, which is a small part of that cancer will be taken, and they can assess what cells are making up that cancer. And then we also look at whether it's in the breast by itself or has it spread outside of the breast. Those are the characteristics that make up the different cancers.
Okay. What are the keys to breast cancer survival? Excuse me.
Well, number one, being hopeful. Number two, the rates of mortality are going down, but that's because of the screenings going up. And so if you're found early, then your chances and odds are better. And so my mother-in-law, to be on a personal note, she was 45 when her breast cancer was found, and she's 74. So there's that hope that you could live for 30 or more years with having had breast cancer.
Okay. What do you think is the biggest factor affecting more women coming in for screenings?
I think this just simple education, getting out and doing talks in the community make the most difference, because if we're not spreading that information and that knowledge to our communities, they're not coming in. And so as access to healthcare improves, those patients will get that message over and over again, whether it's for a sore throat or if it's really for their physical. We can talk about screenings.
Very good. What message would you give someone who has recently been diagnosed or has a friend or family who's recently diagnosed?
I would say that there are many resources, after that first diagnosis is made, as far as cancer navigators, which will help you through the process. There's resources online and small groups that you can lean on. So although it might be a longer process as far as treatment, there are those resources that they can use.
Now, what are some of the barriers to coming in and being screened?
So I think for some women, some of the barriers really are that culturally, we're talking about, a really sensitive subject, and, for them it's kind of a taboo thing to talk about, your breasts. I mean, that's a personal thing. So for them to come in their culture, and I think, even just as women in general, that's kind of hard. And I think also is just a fear of really finding out and knowing. Sometimes they're just like, I just don't want to know. So that people just don't get it done. Or maybe just even a lack of knowledge. We find that a lot. We do education so much, but there's still, I think, people that they really don't know all the facts or know when they should be screened.
And culturally, there are some barriers to males doing breast exams, and some women don't feel comfortable in general with a male doing the breast exam. What I usually tell them is that someone needs to know their breasts, and so if they don't know their breasts, we can't pick out those abnormalities that are concerning. And so we do offer them women providers that can do those exams on their behalf. On my behalf, essentially. If they're my patient, I will refer them to one of my female providers.
Now, Tamara, what can viewers do to help make a difference and help fight against breast cancer?
So the American Cancer Study has had a long history of research and funding, and a lot of, I don't know if most people know that we are actually the second largest funder of breast cancer research in the U.S., right after the National Cancer Institute. So a lot of our funding goes to just research of how actually curing this and preventing it from ever happening. So different, working with the American Cancer Study, we also have a lot of programs out there and support services for patients. We have a program, it's called Reach to Recovery, that is for if you are a breast cancer survivor and you want to give back and help those who have been diagnosed, new survivors, to really reach out to them. And we also have a walk that we do every year, the Making Strides Against Breast Cancer Walk, which is going to happen in Lincoln this year on October 23rd, so people can come out and support. And then the new program we have this year we're doing is the Real Men Wear Pink campaign. So we called on community and businessmen in the different communities. So in Lincoln we have 24 men who have come on board to fundraise and wear an article of pink every day for the month of October. And actually Dr. Anderson is one of our Real Men Wear Pink. And then also, kind of in conjunction with our Making Strides walk.
Very good. Well, thank you both for joining me today and teaching us more about this fight against breast cancer.
Thank you.
You're welcome.
When we return, we're going to learn more about an organization helping girls through running.
It's so great that the parks are tobacco-free zones now.
I know it's so much cleaner and healthier for the kids.
Yeah, I agree.
Excuse me, ma'am. Would you mind not smoking so close to the park? It's a tobacco-free playground. Thank you.
Play cleaner.
Play healthier. Play tobacco-free. Juega libre tobacco. Play tobacco-free.
Girls on the Run is a program that we do here at Saratoga. It's all throughout Lincoln and it's national. Girls on the Run for these girls is going to bring physical activity into their lives.
My favorite thing about Girls on the Run is running.
It's going to make them into a more well-rounded human being.
My favorite thing about Girls on the Run is to encourage other people to run as much as they can and be the best person they can be.
It's going to give them gratitude and self-confidence.
My favorite part of Girls on the Run is actually running laps, because it teaches us that just because we're girls, we can't keep running laps just like boys can. So it teaches us to keep exercising and get it done.
After I'm done running, I feel like I'm awesome.
And it's also fun to not only see the girls start to build some confidence in themselves, but to then when you see the moment when they start building confidence in other girls, it's a really cool feeling.
We encourage each other, we don't judge anyone. It's part of the golden rule. Treat others how you want to be treated. You can just have fun and be yourself and no one's going to judge you for it.
Really, for every aspect of a girl's personality, this is a great club.
Go to Michelle!
So ladies, if you're getting these energy awards, that means we are seeing that you are giving it everything that you have when you come to practice. You're working hard, you're encouraging other girls, and most of all, you believe in yourself and you're not giving up. So, good job.
Coaches, they inspire us to be running, because when we come in, we're weak and we don't want to run and we just want to give up, and the coaches are helping us have a growth mindset and become a better runner and a better exerciser. That's why I set my goals. I started low, like 9, and then I made 14, so I thought I would make it to 16 this time. And then next time we do goals, I will try to make it to 18, so that is our 5K. That's why I set my goals high.
My favorite part of the season is the 5K when we watch all of our training come to life. All of the girls are full of energy that day and they get to see their hard work paid off. We have girls that come into this and they don't believe that they can run a 5K, and by the end of it, they're running it and they're so proud of themselves, and to see the look on their face and the look on their families' faces and how proud they are of themselves really means a lot, and that's why I keep coming back.
I would tell the parents to let their daughters try it.
You need to just encourage them, and I would say absolutely, they're getting exercise, nobody's going to judge them. I would encourage them to do it and run, and they would have a great time.
Girls on the Run is so much fun! Woo!
Shape of the City is dedicated to helping Lincoln stay informed of health and wellness topics and events. Visit our calendar at lincoln.ne.gov, keyword 10health. If you'd like to see your event covered, email us at 10healthlincoln@gmail.com. Thank you for watching. Until next time, get active, eat healthy, and stay informed.